What is a sexual infection? And that's what I'm going to talk a little bit about today, because that's what we do. We do health promotion, health prevention, we do questions, but we're primarily to make sure that we get community screened well and that we try and keep some of those infections contained as well as possible. Chlamydia is a little bit hard, but I'll talk about that in a minute. It can be either viral or bacterial, passed on during unprotected, this is the statement, passed on during unprotected vaginal, anal or oral sex or genital skin-to-skin contact with an infected partner. These infections can often have no symptoms, which means that they don't feel anything. Doesn't burn urine, there's no unusual discharges, no nasty rashes. Quite often they're very clever bugs, that's how they get around. Regular testing is recommended. And what we mean by regular testing is if you've had a partner change, if you haven't worn a condom, if you have up to more than 5 partners within 3 months, and young people will change partners regularly. Once they become sexually active, they're not going to sit down and go, I'm going to get married now, I'm going to have 3 children, I'm going to live my monogamous life very happily, thank you very much. So it's not uncommon for young people to come and see us, and we'll get a history from them, and it'll be something like, how many partners have you had in the last 3 months? And I go, and then you'll go, including oral sex only. And they go, oh, well, because a lot of young people don't see oral sex as sex. They just see it as something you do, like a handshake. So, because a lot of the time young people don't realise, and most people don't realise, that oral sex will transmit infections just as happily as any other form of sex. Because the throat is a nice repository for things like chlamydia and gonorrhea. And if people are only having oral sex, but they're having oral sex with a lot of people, those bugs can get around very, very quickly. So those conversations we often have. So if you're having a number of partners, condom use is not the best, protection is not the best, you're not wearing dams as often as you should, whatever it is that you're doing in relation to your sexual exposure to infections, we always recommend that you should come in. If it's high risk, probably every 3 months. 6 months is okay. Young people, we're at least a year. At least once a year they should be getting their regular checkup. And that may only just necessarily be a urine, but we ask the questions and it'll tell us what. Does that all make sense? Viral is something like HIV is a virus, herpes is a virus. Who's got herpes? Come on. Who sees a... Shush! I'm talking about these little furry critters. Little furry critters. You've got herpes, there you go, you lucky Chucky. Oh, well, there you go. No, give them back, we love those. So herpes is also a virus. Herpes is manageable, but a lot of young people get very, very upset when they find out they might have a herpes infection, because that's a conversation. How do you have that conversation with your sexual partner? I really want to have sex with you, but I need to let you know I've got herpes. It's very, very difficult. So we get more counselling sessions through herpes than we do even through HIV. It's really interesting, that. So we try and normalise it and say, look, it's not a dangerous thing, it's a manageable thing, but unfortunately it probably won't go. So, and bacterial is things like chlamydia, gonorrhea, things like that. Virus, you can either manage and control it, or it will eventually pass. HPV is another virus, which is the genital warts, HPV vaccine. Bacterial, antibiotics. You can't give antibiotics for a virus, doesn't work. Antibiotics is all bacterial, so things like chlamydia and gonorrhea, syphilis, which is... Who's got syphilis? You've got syphilis. Hold up syphilis. We like syphilis. As a little spirochete. And it's still around. So a little bit of information. Chlamydia is the most common bacterial infection. As an example, there were 26,041 cases reported in New South Wales in 2016. So it's a clever bug, it gets around. 75% of the cases are in young people, 15 to 29, because they're the ones usually having most partners. And that unprotected oral sex I was talking about a few minutes ago. Repeat and untreated infections can lead to PID, which is pelvic inflammatory disease in women, but you can also get a pelvic inflammatory disease in men that can cause infertility. And a lot of the fertility clinics you'll find are women and men attending because they've had an untreated chlamydia infection way back somewhere, and they've got all sorts of scarring and issues going on within their reproductive tracts. And they finally found out about that, and there'd been some management. So if you've got a young woman who's feeling unwell and they don't know what's going on and they're sexually active, but they haven't been sexually active for a while and they can't work why they're unwell, it's really a good idea to make sure you get them to go and see their GP or come and see us, because they may have actually an untreated PID because they had chlamydia somewhere down the track that never got treated because they didn't know they had it. Because 85% of people with chlamydia are asymptomatic, which means they don't know they've got it. And it's infectious for up to 2 years. So you do the math. So it's a clever little bug. If people do have chlamydia, they'll find that they have a clear penile discharge often from the penis. They will get a discharge from the vagina or the front hole or the back hole, but they may not recognise it for that. The penis is a little bit easier. They may get a bit of pain when they pass urine. They may get a little bit of lower abdominal pain. Some males may get scrotal pain, but it may be nothing. Any questions? Back. Urine or a swab test is all it needs, and that's one of the things we do with the Ulladulla school camp, is we do a lot of screening with the young people because they're year 11, and we get all the kids to screen. And basically it's just to get them used to what it feels like to do a pee test. That's all it is. It's an educational opportunity to tell a young person, if you think you've got chlamydia or you've had unprotected sex, we don't do anything nasty and invasive. It's just you come to us, we give you a jar, you wee in the jar, we send it off and we get the result. And that's really, and it's quite safe. The swab is if you want to do a throat swab, or we want to do a bottom swab, or we want to do a vaginal swab or a whole swab. There's all sorts of ways, but the wee test is one of the simplest. And the Caddyshack program is wonderful for that. They go down to all the beaches and they do all the young people on the beach, and it's great. The main treatment is 1 dose of antibiotics, which is 2 tablets 1 time. So again, nice and simple. And that's if it's, so that helps young people to recognise it's not something you've got to be, getting injections and weird and wonderful things going on. But chlamydia is the big one. Chlamydia is the one that we know in some ways it's plateaued, and we think it's plateaued because a lot of young people are getting more testing, which is good, because that means people are coming to see us, people are coming to see their GPs. The GP is a big site. If they just ask the questions more and they just did a little bit more screening, we would really be getting somewhere as well. The other virus, one of the viruses that we talked about is the HPV, or the human papilloma virus. Anyone heard of the Gardasil or cervical cancer vaccination that all the kids are getting at school? No? I bet you had it. It's been going since 2007 in the schools. It was invented in Australia. Wonderful vaccination. When I was nursing a lot of women who were dying from cervical cancer. Bad way to go. This is one of the vaccines that helps prevent that. The girls were started to be vaccinated in 2007, and then there was a big push to get the boys as well. Makes sense. Some boys may never have sex with a girl. So that's that whole thing about, so we had to negotiate that. And part of it was, there's throat cancer risks as well as anal cancers and things like that. They needed to get the whole, what we called herd immunity. So you immune the herd. You try and get as many people vaccinated as possible so the bug cannot get around. Which is why the smallpox virus you don't hear from anymore, because smallpox was eradicated through vaccination.
Why don't they do the HPV injections for older people? Is it like
because
because
with HPV, if you've had sex with more than one person in your life, you've probably come in contact with the virus. So what they're doing is they're vaccinating all school children, hopefully before they're sexually active. So year 7 is usually they're looking at. So they're trying to get young people. There was a big push and a catch-up with young women between 18 and 26 back in 2007. And when I was working in a general practice up in the Campbelltown area, I think we ended up vaccinating about 4,000 women. It was huge, but it was such a good outcome because the HPV vaccine, there's a study that was done back in 2003, people are still showing immunity 10 years down the track to that immunity. So they don't think that it wanes. So it's protecting young people. So it protects them against, as you see, 79% of people will be infected in their lifetime by this HPV. Some strains of the HPV can cause cancers, and that's what some of those the vaccine has. Others will cause the genital warts. We're not seeing as many warts as we used to anymore, which is great. Most infections will clear without concern. Your body's immune system will allow that HPV to be eradicated, but it can take a couple of years. The PAP screening program was to screen for HPV. It was to screen for abnormalities. So every 2 years women would go and have a PAP screen, and it was about the 90s that the HPV was identified as the cause of the cervical cancers. Yeah. And so every 2 years women were getting the PAP screens. That's changed now because the vaccine has prolonged the opportunity for people to have screens now only every 5 years, and they're specifically looking for this virus. But if you notice any abnormalities or any young person you're worried about, make sure that they go and see somebody before that 5 years is up. Most infections will clear, and school vaccination program, the Gardas will too, and this program now includes girls and boys. And there's a great graph, and it's not on this, but there's this graph which shows young people, 2007, the vaccine kicks in, and it talks about HPV exposure, and it just plummets away. And I've never seen a graph like that. It's the most inspiring graph, and it's just been wonderful.